We'll go ahead and get started. Again, I just want to thank everybody for taking the time to join this webinar today. We have Erin Shore presenting with us today. So Erin's a fifth-year PhD candidate in the Epidemiology department at the Gillings School of Public Health at UNC Chapel Hill. She has an MPH in Epidemiology from Emory University, as do I, Erin. I don't think we discussed that. And a bachelor's degree in health and exercise science from the University of Oklahoma. Her research focuses on surveillance and prevention of catastrophic sport-related injuries. And Erin is one of our UNC IPRC Injury and Violence Prevention Fellows this year. We're excited to hear this is part of her dissertation research. So Erin, on that note, I'll let you go ahead and begin. And then y'all, if you have questions, just please hold them to the end and Erin will be able to answer those. So again, thanks so much for joining today.
Thank you so much for the introduction and the opportunity to present. Yeah, this is part of my dissertation work. So I was looking at social and structural inequities in access to AT services or athletic training services among public U.S. high schools. So I'll have just a quick outline, pretty standard, and I'll get right into some of the introduction background material. So athletic trainers have a really wide array of workplace responsibilities. And in high school specifically, like planning and implementing injury prevention programs to being someone that treats an injury when it happens, helping athletes rehab and recover from their injuries. And then at the high school level specifically, there's a lot of education involved. So they're helping to educate athletes, parents, coaches, school staff on injury prevention recommendations and emergency preparedness planning. And they also have to attend as many practices and competitions as possible. And I've read some studies that show that during the sports season, they are working as many as 50 or 60 hours a week. Um, and to give kind of credence as to why athletic trainers are important in the US, I wanted to show that in high schools for the academic year from a couple years ago, 2022, 2023, there were 7.8 million student athletes across the country at the high school level. And of those, there's an estimated to be 2.4 injuries per 1,000 athlete exposures, or a total of 1.5 million injuries total. So that's a pretty big proportion of those student athletes that are suffering some kind of injury. And then, as Steph mentioned, my research is more focused on catastrophic sport-related injuries. So for that same academic year, we saw 92 sport-related catastrophic injuries. And if you're unaware, catastrophic injuries in sport are things that could potentially be fatal. So things like sudden cardiac arrest or heat stroke or spinal cord injury, things of those type of magnitude. And then in terms of access to AT services among US high schools, there is this really great project called the Atlas Project out of Corey Stringer Institute at the University of Connecticut that has looked at AT services across the country. And from that project, we know that about a third of all high schools have no access to athletic training. And then a little over a third have access to full time, which is considered 30 hours per week of coverage at the school. And then 30% about have the part-time, which is anywhere from 1 to 29 hours of coverage per week. And then some studies have shown that there are some kind of known inequities in access to care. So high schools that are less likely to employ an athletic trainer typically are smaller, in lower socioeconomic areas, and in rural communities. Um, so I noticed a few gaps in the literature that I was hoping to address with this project. So in terms of measures of socioeconomic status, most studies use percent of students on free and reduced lunch, which I have read sometimes tends to overestimate the poverty level of the school. And in recent years, a lot of the research on access to healthcare are starting to use deprivation indices, which are a little more holistic look at the community. Um, in terms of disparities by racial or ethnic distribution of the students, um, not many studies have addressed this with specific respect to athletic training services. And we know in the US there is a history of racism in our healthcare system, and that people who are racially and ethnically minoritized have less access and worse health outcomes compared to their white counterparts. So I wanted to see if there were any disparities based on the racial or ethnic distribution at the high school level in terms of access to athletic training. And then some potential interaction between the racial and ethnic distribution and more macro level factors. So again, we know that there has been a system of structural racism in the country that has kind of created these inequities in access to healthcare based on, historic redlining or things of that nature that um, kind of have downstream effects in terms of access to healthcare. So I was interested to see if there was any of that happening with respect to access to athletic training services. Which brings me to the study purpose. So I wanted to examine association between social and structural factors with access to AT services at high schools in the US, specifically community and school level socioeconomic status, and then the geographic location. And I wanted to see if these associations differed by the racial and ethnic distribution of students at the high schools, of the student population at high schools. So for our study design and population, this is a cross-sectional study, and our study population was all public high schools in the US during the academic year 2023-24, so last academic year. And we focused on public schools specifically because we felt like the exposures we were interested in are kind of related to public school funding, and the private schools might not be as affected by those community measures. This is just kind of a big summary table of my data sources and measures, but so for AT employment, we ended up doing a dichotomous variable of just no AT versus any AT. So this any AT category contains both part and full-time. And like I mentioned earlier, this comes from the Atlas project, which is maintained by the Corey Stringer Institute and the National Athletic Training Association. The deprivation index that I was interested in is called the Social Deprivation Index score. It comes from the American Community Survey from 7 different community level measures, and the Robert Graham Center developed it. This serves as an exposure and a covariate in this study, and it's a continuous variable from 0 to 100. And in the model, we had the functional form of restricted cubic splines. I also looked at proportion of students enrolled in free and reduced lunch because I was interested to see how that performed relative to the social deprivation index. And it also was a continuous variable from 0 to 100. And we used, again, restricted cubic splines for that. And that comes from the US Department of Education. For the rural urban category, we use the rural urban continuum code from the US Department of Agriculture, and that's a categorical variable from 1 to 9, where 1 is the most urban and 9 is the most rural, and we dichotomized it into a kind of urban versus rural. And then for the racial distribution of the students enrolled, I derived this again from data from the United States Department of Education, and I totaled, it was like a sum of all of the Black, American Indian, Alaska Native, Asian, Hawaiian, other Pacific Islander students identifying as 2 or more races, and Hispanic students. And then I divided that by the total number of students at the school to get a measure of the proportion of the student body that was considered racially and ethnically minoritized. I wanted to look at each race individually, but there just wasn't enough statistical power to be able to do that. And this was also continuous 0 to 100. And in the actual statistical models, we looked at it via tertile, where I was comparing those with the highest proportion of racially and ethnically minoritized students to those with the lowest proportion. Um, so for our statistical analysis, we did use multiple imputation to account for some missing data. We had missing data for proportion of students on free and reduced lunch and athletic trainer employment. And so we employed imputation to help address that. And then the statistical models were linear risk regression that followed a binomial distribution. And we used generalized estimating equations to count for any clustering that might occur at the state level. And I wanted to share my directed acyclic graph, or DAG, that these are the hypothesized associations. And so this was kind of the model that I was going off of when thinking about designing the study and what to include in the adjusted models and everything. I did want to point out, like, we know size of school is related to this, but since it is on what we call the causal pathway, we did not end up including it in the models because we were interested in the total effect rather than just the direct effect from this. So I am aware that that is maybe confusing why it's not included in the model. Um, Onto some of the results. These are just some descriptive results, all of our continuous variables. So these show the average and standard deviation of the continuous variables we were interested in. I do want to make it clear that for these, like proportion of students enrolled in free and reduced lunch and all of the proportion of racially and ethnically minoritized students, it is the school level average, not necessarily the average of all students in the US. I didn't know if that would be confusing or not, but we can see similar numbers for social deprivation index and proportion of students on free and reduced lunch. They're slightly different, but they're both on 1 to 100 scale. And then we have for the categorical variables, we can see that most students are attending schools in urban areas. Most have athletic trainers employed. And then I just wanted to show the specific percentile breakdowns for the tertiles. So in tertile 1, it's 0 to 18, and then the third tertile is 55% to 100%. So on to some model results. For SDI score, this model was adjusted for the rural urban category. And like I said, we used generalized estimating equations to account for clustering at the state level. And as you can see, as the social deprivation score increases, so this is more community deprivation, we see fewer schools with an AT employed. And it's a pretty, there's a nice dose response relationship there that you can see. For the proportion of students enrolled in free and reduced lunch, we see a similar association where as we see more students on free and reduced lunch, we see fewer schools that have ATs employed. But I think it's interesting that the relationship is a little bit different. There's not very much difference between those at 25 and 50% and those at 75 and 90%. So it's kind of these jumps that are happening here. In terms of rural urban continuum code, as expected, we see that schools in urban areas have more access to ATs compared to schools in rural areas. I did run this model adjusting for percent of students on free and reduced lunch instead of SDI score, but the results were really similar. So I'm only presenting one because I'm already showing you too many tables. For the effect measure modification, so to kind of orient you to this table, this is showing that, at an SDI score of 25, we calculated the proportion of AT employment for those in the lowest and highest tertile in terms of proportion of racially and ethnically minoritized students, and did the same thing at an SDI score of 75. So you can see here, there's not a huge difference between schools within the SDI score of 25 that have a different racial distribution of the students. And the same here the 75 at the higher end of the deprivation index. They're pretty similar. But what is noticeable again is that schools at an SD at the lower deprivation have more access compared to those with a higher deprivation score. For percent of students on free and reduced lunch, this one was a bit different. So again, at this lower end of proportion of students on free and reduced lunch, so schools with higher SES, we see that schools in the lower tertile of proportion of racially and ethnically minoritized students do have more um, athletic trainers compared to those schools at the higher end. So there is a little evidence of a disparity here, and we see similar here. I will say the sample size for these is pretty low, so I'm still kind of working through if this what this means because I think like this category had maybe 11 schools in it. Um, but I mean, from this, we're seeing a little bit of an association, I would think. And then again, the percent of students enrolled in free and reduced lunch is a big driver of these associations. In terms of rural urban continuum code, we're not seeing much of any substantial evidence for modification based on the percent of students that are racially and ethnically minoritized. Um, they're pretty similar estimates here, but again, at the SDI score is really what is driving the associations. Um, okay. I I think I was copy pasting and I should have had rural urban category here and this is urban and this is rural. My mistake. Again, too many tables, I couldn't keep track of them. But these numbers are correct. I also wanted to show that while there may not have been substantial evidence for effect measure modification, we do see that the proportion of racially and ethnically minoritized students is strongly associated with the exposures of interest. So this shows the median proportion of racial and ethnically minoritized students at each score of SDI that I looked at. And you can see that schools with more deprivation had much higher proportions of racially and ethnically minoritized students compared to schools with less deprivation. And we see a really similar pattern here among percent of students enrolled in free and reduced lunch. And then the kind of opposite is what we're seeing here for rural urban continuum code, where urban schools have more students that are racially and ethnically minoritized. So kind of some of the key takeaways are kind of reinforcing what we already knew that schools in higher deprivation areas have less access to AT services and schools with more students on free and reduced lunch and in rural areas have less access. And I just kind of confirming what we already knew. And I think that this may have been one of the first studies to really assess using a deprivation index. So that slightly different. And then some differences by the racially and ethnically minoritized students. Like I said, I'm still kind of mulling over the free and reduced lunch, but I think in general, we weren't seeing substantial evidence for effect measure modification by the proportion of racially and ethnically minoritized students, but we were seeing that that the distribution of racially and ethnically minoritized students differed by the exposure, in particular, the social deprivation index score and percent of students on free and reduced lunch. So to me, this is kind of indicating that there could be kind of an indirect effect where by virtue of the school they attend, racially and ethnically minoritized students have less access to AT services. I wanted to mention some strengths and limitations and future directions of research. Strengths, this is a large nationwide database, and we were able to account for some of the missing data using multiple imputation. And the Atlas database is updated regularly, so that really reduces the potential for misclassification of the outcome. Some limitations are rural urban continuum code category is at the county level. So I think that could be obscuring some differences if there are large counties that have both rural and urban areas. And then again, we're making an assumption that AT services are the same across schools. So because we did the dichotomous variable, schools with 5 hours of AT coverage are being treated the same as schools with 40 hours of AT coverage per school week. So there might be some differences between those. In terms of future direction, I think interventions that provide access to care, I would love to see some work done in that area. Also assessing full-time versus part-time access. What are the differences? What are the drivers of that? And then using some more historical and current measures of structural racism on access to AT services, envisioning more of like a spatial analysis using historic redlining or something of that nature, just to see how that maps out to which schools have access to AT services. Um, we want to acknowledge the co-authors of this study, and also the Corey Stringer Institute and the NATA for allowing me to use their data, and the UNC IPRC IVP Fellowship, which I'm really grateful to be a part of this year. So that is all I had. Um,
Wonderful. Thank you so much. Do people have questions? We have about 6 minutes. Feel free to jump in. Oh, anybody? Sorry, I thought I saw a hand and was clapping. I have a question, Erin. And
yes.
was there anything in particular that really surprised you as you were kind of working through your analyses and your findings?
Um, I think I did expect to see the like more effect measure modification, like specifically with the SDI. I was pretty surprised that the um, proportion of racially and ethnically minoritized students didn't affect that, but it was also like I was glad to see that because I didn't necessarily like want to see evidence of that. Um, but I wasn't like super surprised. A lot of the um, relationships has kind of been described on like a state level. So just like doing it nationally was kind of interesting, but
Yeah.
no huge surprises there.
And just a quick note, just something you might check into it. And then I was thinking about the reduced lunch. I
Hmm.
don't know what happened, and I have no idea how it affected high schools, but I feel like from COVID on, there was a big push, right, for everybody to get breakfast and lunch. I think at
Hmm.
least at elementary schools. I don't know. So I'm not sure if you've checked into all of the like
Yeah,
recent
that's
changes
a
in that.
really good point. I should check into that for like the specific year because a lot of the literature I was basing this off of was pre-COVID. So that's a really good point.
Yeah, I'm not sure. I was trying to remember back to when my nephew was in elementary, like I mean he still is in elementary school, but in the past few years, and I feel like I heard my mom or somebody say like, oh yeah, that he gets free breakfast and free lunch or something.
Yeah.
So again, I don't know if that's just everybody or anyway. So yeah.
Yeah.
Kristen, do you
In
want to ask your question?
Yes, great job, Erin. Was really excited to hear your results of your study. I was just thinking if you have thought of or dove into, you mentioned that athletic training services and just, the 5 hours versus 40 hours. And I mean, as we know, it's a really big difference in services. Have you thought about breaking that up a little bit, or even if you're able to?
Yeah, I started to do that a little bit just based on part-time and full-time, but it just became like too much for one study. I was already looking at so much, and it was a methodological thing too, because in order to do that, I would need to use logistic regression. And so my chair and I decided to stick with the linear risk regression since that was what my first aim had looked at. And we decided the full-time, part-time would be a follow-up paper. But from my basic looking at it, I can tell you there was a relationship between, there's a clear difference between full-time and none. At the part-time, there was no real relationship.
Mm.
Like it was kind of a straight line across in terms of access. So I thought that was interesting. I just haven't had the chance to fully dive into that aspect yet, but it's on the list.
Okay, cool. Thanks so much.
Okay, we have time for like one final question and then we need to wrap it up. Anybody else have any questions for Erin? All right, great job, Erin. Thank you so much again for
Thank
taking the
you.
time to share with us. Really interesting work, especially given the fact that like this is not my line of research, so I learn things. Um, so yeah, so thanks everybody for taking the time today to join us. Next month we have Jessie Brunner speaking from Stanford. She's going to be talking about human trafficking. So we'll look forward to hearing that as well. Okay, take care. Bye-bye.
Thanks. Bye.